How to be an efficient CEO in a service industry like a hospital? Everybody knows the basics. The bottom line is, end of the year, the hospital should show financial growth, profit, right? And there are various things people do. They have advertisements, marketing, patient care, quality care, new technologies being introduced, many things. But there is one very important thing most CEOs forget to practice in hospitals. That is people management. Hospital is not a manufacturing industry. It's a service industry. Full of people, managers, doctors, nurses, ward boys, lab technicians, paramedical staff, cleaners, sweepers, gardeners, ambulance drivers, patients, their relatives, their well-wishers, their friends. And it's not ever a one-to-one interaction between people. It's one-to-many interaction. Everybody is interacting with everyone else. It's a continuous network, like a computer motherboard. Lot of interactions, lot of communications, lot of emotions at play. It's a very stressful industry, unlike a hotel where people come for a holiday happy. No, here people come unhappy because they are sick, they are anxious. So people management is very important, and that is the one thing I want to emphasize, because that is the one thing which most CEOs and managers in hospitals forget or fail to practice. There are about 26 basic things. Let me introduce one by one. Number one, stop micromanaging. When you employ people, of course you do an interview, you select for what their worth is. Give them the space to do what they know. And you know that when you employ someone, they know about that aspect better than you, because you are not king of all trades. A CEO is just a supervising element. Don't believe that just because you became a CEO or a manager, you know everything about finance, marketing, gardening, housekeeping, water, electricity, medicines, pharmacy, procurement, supply chain, kitchen, food, how to prepare food. You see, you have to delegate and give responsibility. Stop doing micromanagement. Stop breathing down people's neck and telling them how to do things. If you know how to do things, you don't have to employ anyone, you just do it. So give them the space, but of course keep a distance, have a controlled supervision. If things go really wrong, find out and correct it or rectify it. But don't get into the habit of micromanagement. That's rule number one. Rule number two, when things go wrong, stop blaming a person. Usually in a situation like a hospital, when things go wrong, it's usually outwardly seem like it went wrong because of a person, but if you look deeper, there is a fault in the system. And you have to do a root cause analysis, find the fault in the system and correct the system. If you don't look into that and you just identify a person to put the blame on and be happy about it, that is very demotivating, not only for that person but for everyone around. And it gives a continuous chain of emotional breakdown where people are constantly worried, are they going to be the next target of blaming? But when things go wrong, if you look at the system and shift the focus of blaming from the person to the system and correct the system, then everybody gets motivated and encouraged. And we'll work towards thinking of methods on how to improve the system and how to prevent such a mishap from happening in the future. Very rarely you may find a person particularly being responsible for what went wrong, irresponsible, lazy, disinterested, behavioral problem, in which case you have to reprimand him, explain very clearly what he did wrong. Also, before penalizing or punishing him, think, can he be put into a better service in another area of the hospital? You know, square pegs don't fit into round holes and vice versa. If it's a square peg and in a round hole, you move the peg to a square hole and it fits in well. Look around. Usually you find places where an inadequate, irresponsible, incompetent employee performs better. For example, a clerk who is always smiling and is in the habit of talking, interacting with people, is better off being transferred as a public relations officer. Just an example. Think about it before taking a final call on suspending or dismissing a person, because employee turnover is not a good sign, is not a healthy sign for any hospital. People come to know how many people left the hospital, how many people stayed for how long. When new competent people want to apply to a hospital for a job, if the employee turnover is high, then that's a put off for them. Number 3, never institute award for the best employee of the year. Everybody is equally good. And best employee of the year award is actually demotivating for many others who do equally good work in some other fields. Best is to give an annual award for the best idea of the year. Encourage every employee of the hospital to come up with ideas. Doctors, ward boys, gardeners, peons, let it be anyone, nurses, nursing director, anyone. Come with ideas for growth and progress of the hospital. At the end of the year, you identify the best idea, which you implement, and then give the award for the best idea. This makes people spend their time thinking of ideas and discussing ideas rather than gossiping and discussing about people. The next important thing is to give small appreciations every day. Don't reserve your appreciation or praise for the annual day celebrations. A little pat on the back, a little appreciation of their work, or even their appearance, their latest hairdo, their latest costume, their latest behavior, the latest even pen or some glasses some people must have bought. Just look at something to appreciate. Make them feel important. When you appreciate people, they feel important. And if they feel important, they will work hard for you because you made them feel important. And they'll be ever so grateful to you. Every day, look for something to appreciate. And you will always find something to appreciate in every person working in a hospital. Make it a habit to visit some patients or as many patients and their bystanders during rounds. Just say hello to them, introduce yourself, ask any concerns, check with the nurses, check with the cleaners. Many a times they are the ones who will inform if a trouble is brewing up due to dissatisfaction among the patients or their relatives. Nip it in the bud, smile at them, find out what's wrong, what's causing them worry. Call the doctor, call the consultant, call the nurse, explain to them this is a problem, come and solve it. Patients feel important, and you have solved a problem, nipped in the bud, and stopped it from becoming monstrous. Every employee who leaves the institution must have an exit interview to give feedback, but exit interview should be done only after giving them the experience certificate and all the payment arrears are paid to them. If it is done before, they may not be giving the true picture of what they think about the institute. What you want is a positive, a genuine feedback. Positive or negative, a genuine feedback, not a false feedback. So to give a genuine feedback, they should feel comfortable that all their payments have been done, all their certificates have been given, they are free. Once they have left, follow up on their career. Make a phone call, few weeks, few months, how are you? What's your new job? How do you find it? You're always welcome back. It not only makes them feel important and good, the word spreads around. If any of their friends who are competent want to work in a hospital, they would definitely recommend you a hospital. But they say that if you go to that hospital, you will be looked after not only during your work period, but even after you leave the hospital. An efficient CEO or manager will surround himself with people smarter than him, not more stupid than him. You get good ideas and suggestions from people smarter than you. Always interact with people smarter than you. Spend more time with them. Least time or no time at all with people who apple polish you, who praise you, who sing songs of praise, flattering. Don't fall for that. Surround yourself with people smarter than you. If you want respect from your employees, don't demand that respect. Give respect first. Respect has to be earned, cannot be demanded. Any respect that is demanded is fake. You give respect. Everybody needs respect. Even the lowest strata employee to the highest strata employee, they all need respect appropriate to their position and status. Even the bellboy in the lift deserves a hello, how are you? You look tired. You look fresh. Did you sleep well? Show some respect. They will respect you more. Every hospital needs referral from other doctors, and hospitals maintain a good relation with all the doctors near and far. Because any doctor who wants to refer a case, they want to refer to a hospital where they can easily call and get an appointment or get an admission for the patient, and also get a feedback on how the patient is doing. So maintain a good relation, personal relation with doctors near and far. Now there's something called Herzberg's motivation hygiene theory. Motivating factors has to be very high. The higher it is, the better. What are the motivating factors? As I mentioned earlier, appreciation, giving greater responsibility to the employees, no micromanaging, no breathing down the shoulder, give them responsibility, give them guidance if they need guidance, and help them grow in their career. The more you help in these areas, the more motivated they are, the better the performance. Hygiene factors are things which has to be maintained at a certain level. It should not go down, but increasing it doesn't really help in outcome. What is that? Number one, salary and perks. Everybody needs a salary appropriate to their job. If it goes below that, they will be demotivated. If it goes higher, double, triple, it's not going to increase the work output. It's a wrong concept. Many people say, hey, I increased your salary double. Why you are not working more? Because that's a hygiene factor you have improved. It doesn't help. But it should not come down below a certain level. The other thing is working condition has to be appropriate. Increasing it multitude doesn't improve productivity. Decreasing it worsens productivity. Policies appropriate to the job. Interpersonal relationship should be maintained among all the staff, no politics. If interpersonal relationship goes down, productivity goes down. Every employee has a status of his own in the hospital. Make sure the status appropriate to him is given to him. Don't let it come down. But these hygiene factors, if you increase further, it's not going to improve productivity. Motivating factors, on the contrary, you increase it more, the more the productivity. Next rule, make promises only if you can deliver. Don't make false promises. A false promise is looked down upon by every employee, and that brings down your respect in the hospital. Employee productivity and work commitment is directly proportional to the respect they have for the CEO or the manager in the hospital. If you cannot fulfill a promise, don't make the promise and explain why you cannot do it. Be transparent. If a policy is made or certain protocols to be followed, explain why it is to be done. Don't just push it on to people. When you say this is to be done, you have to explain why it is to be done. When you say you have to come at 9 o'clock in the morning for work, you must say why. If you suddenly change it to 8:30, you must explain why. When every policy and protocol is explained with the reason behind it, the acceptance is almost 10%. Many employees come to you with requests or demands. If you refuse it, you have to explain again why. Don't just say, I cannot do it. If somebody comes and asks, okay, I want a rise of pay. If you cannot do it, you explain why you cannot. You have to bring statistics, his productivity, the market rate, how many leaves he has taken, everything put into place and say, because of this, I cannot afford to raise your salary. But when things improve, we can. But at present, I cannot. Don't just say, I cannot. If a doctor asks for an equipment, you cannot say, I cannot buy it. You have to explain why it is not possible, depending on the workload, the possibility of its use, the investment versus returns from that equipment, everything to be studied and explained to him. Because of this, I cannot buy this equipment now. That has a much, much greater acceptance and satisfaction for the person who comes with the request. Show by example, be punctual, especially for meetings. If you want to start a meeting at 3 o'clock, start the meeting at 3 o'clock, even if nobody is in the auditorium. The next time you start a meeting at 3 o'clock, the auditorium will be full at 3 o'clock. But if you delay it, you don't value time, people will continue to be delayed. And for every meeting, you must have a starting time and a finishing time, because people should know time is value. And you must finish on time. And during meetings, keep the emphasis on solutions, not on blaming, fault finding persons. Always, when a problem is discussed, focus on the solution. As a CEO and a manager, you have to keep updated with all the numbers and audit in the hospital. Inpatients, outpatients, casualty visits, how many patients refused admission, how many lab reports were done, what is the average time for an X-ray waiting period from the time X-ray is done to the delivery of the X-ray, either in the PACS machine or the hard copy. Everything has to be audited, and the CEO or manager should have these numbers at his fingertips. That gives power, that gives respect. People know that you are fully involved with the running of the hospital, and when the leader is involved, everybody else in the team will follow the same. They will also show a passionate involvement in the smooth running of the hospital. When you want to take decisions, always be democratic in getting facts. Get the facts, get the numbers, get the possibilities from each and every one. Once you have collected all this, you work it in your mind and take a decision autocratic. Collect the facts in a democratic way. Take the decision in an autocratic way. Why? Because if you take the decision in an autocratic way, you are the only person responsible if it doesn't work. So you will absolutely make sure that it works before you take the decision. But if you take a collective decision, everybody involved, then nobody takes responsibility. And the commitment to make sure that that decision becomes successful gets diluted. So be autocratic in implementing, taking a decision, implementing decision, take responsibility. But before taking a decision autocratically, collect the facts in a democratic manner. So everybody is involved in giving you suggestions. Coming to manpower, you have to make sure there is adequate manpower. Nothing more, nothing less. Too many people for a work spoils the broth. Too less people, too much stress for the people who are doing the work. Adequate manpower should always be maintained. It's very important. Practice Kaizen. Kaizen is a Japanese word for continuous small incremental progress on a daily basis. Every day when you come to the hospital, you must have only one thought in mind. How can this hospital be better than what it was compared to yesterday? Let it be 0.001% better. Doesn't matter. It has to be better in some aspect. Either in the garden, or in the patient satisfaction, or in the surgical numbers, or in the employee satisfaction, or the quality of the food, or in the lighting in the corridor. It doesn't matter. Something should be better than what it was yesterday. That is Kaizen. And every day you practice, at the end of 365 days, a huge improvement you can see in all aspects of the hospital. As a hospital manager and CEO, you have to keep updated about changing trends, telemedicine, electronic, paperless record keeping. You have all the changing technique like PACS and laboratory, lab reports, all getting into what are the latest technology that is coming. And you have to keep updated with all this. You have to attend international or national conferences on hospital administration and see what's happening in other hospitals, what is the growth. Now it's AI mediated, everything is going AI mediated. So what is practicality, how it can be implemented? Lot of things you can learn by attending these hospital management administrators conferences, which is held every year throughout the world. To your employees, especially doctors and nurses, encourage academic excellence. Continuous medical education, CME, has to be done on a regular basis, daily or weekly. Academic excellence, if it goes down, motivation and interest in the profession goes down, because medical practice is driven by changing trends on a day-to-day basis. Everybody must feel updated, and the more knowledgeable people are, the better the service, the more confident they are, the happier they are. You must remember that you don't have employees or subordinates under you. What you have are people who is part of your team. Nobody is superior, nobody is inferior. You are all part of the team. You all roll up your sleeves in the morning, get down to work. Everybody has job specifications, very clearly instruct what the job description is, so everyone is clear. But everybody works as a team. No superiority, no inferiority thing in this. When it comes to decision making, yes, you may say you are superior, but that's not what you are doing. You are not behaving like a superior. You are behaving like a responsible team member, working for the benefit of the team and the hospital. Communication, you have to emphasize people, doctors, nurses, everyone, ward boys, cleaners, to talk to each other, to ask questions, stop thinking. Quite often we hear people saying that, the doctors, nurses saying that, oh, I thought she did it, I thought you would have done it, I thought you had asked me to do, I thought I don't have to inform you, I thought you will inform me, I thought. Stop this I thought. Stop thinking. Just ask, clarify, make sure, ask questions. That will help clarify your mind, and that will also help interpersonal relationships. The more you talk to people, the more you know each other, the more you work as a team. You are no more strangers, you are part of the entire team. These are the basic lessons and principles which most CEOs and managers probably know. You ask anyone, they say, oh, all this we know, but how many practice? When it comes to practicing this, most people ignore, because they are after profit loss account. They are looking at numbers of finances. Yes, that is important. You cannot run a hospital incurring losses. Hospital must have profit to buy equipments, to pay the salary, to upgrade itself. Money is important. But ignoring these personal things will cause definitely loss for the hospital. Because we are dealing with a service industry, not manufacturing industry. Two things I want to tell before I conclude. Number one, people leave their bosses. They don't leave their job. Most often, there may be exceptions, but most often, When an employee leaves the hospital, as a manager or CEO, you must remember he or she is not leaving the hospital. He or she is leaving you, your leadership. They don't like you. That's why they are leaving. Because they go to some other hospital and do the same job. If it is the job they are leaving, they won't do the same job in another hospital. It is you they are leaving. When people leave, remember, they are not leaving the job, they are leaving their boss. Look into yourself. See how you can correct yourself. How you can improve things. By improving yourself. By focusing on people management. That's number one. Number two, most important. People, your employees, your team, your patient, your bystanders, your relatives, doctors in different parts of the world who you interact with, your referring physicians. People often forget what you told or what you did to them, but they will never forget how you made them feel. Make people feel important, make people feel happy, make people feel like smiling, make people feel like looking forward to Monday morning when they can come back to work, and not Saturday evening when they can go back. That's how an efficient manager and CEO should work for the growth and betterment of the hospital, patients, and employees of the hospital. Thank you.